The bill I chose was H.R. 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. My thesis statement: nurse-to-patient ratios in hospitals should be mandated because it would contribute to job satisfaction, positive patient outcomes, and decrease the likelihood of adverse patient events. Nurse-to-patient ratios have a significant impact on patient care and job satisfaction. Patients are more acute and need the nurse's knowledge, experience, and critical thinking to be able to form relationships with patients and families, as well as provide exceptional care. When nurses have too many patients to care for, they face increased levels of job dissatisfaction, burnout, and have feelings of being overwhelmed. These factors have been found to increase the intent to leave the bedside. Mandating nurse-to-patient ratios is vital to improve patient outcomes. Positive patient outcomes include patient safety, reducing 30-day readmission rates, and ensuring patient satisfaction. Evidence suggests improving staffing ratios is an important investment to improve what patients perceive as better care. Decreasing the likelihood of adverse effects on hospitalized patients is imperative to improving quality care. The more patients a nurse is caring for at one time increases the risk of harm to a patient. Increased hospital-acquired pneumonia, falls with injury, pressure ulcers, and wound infections are adverse events that eventually cost more for the organization and for the patient, with increased procedures and an increased length of stay. By mandating nurse-to-patient ratios, research shows higher labor costs will be offset by reducing admissions to higher level of care from adverse events and reducing length of stay. There is a link between better nurse ratios and lower rates of adverse effects on our patients. H.R. 2581. What is this bill's main purpose? The main purpose of this bill is to establish requirements for direct care registered nurse staffing ratios. The bill proposes strict nurse-to-patient ratios which differ depending on the type of specialty. For example, a med-surg unit ratios might be 1 nurse to 4 patients. In a rehab unit, it may be 1 nurse to 6 patients. In the ICU, it's 1 nurse to 1 or 2 patients. And a step down could be 1 nurse to 3 patients. This bill also has a focus on the competency level to which the nurse must demonstrate education and training. Nurses need to demonstrate their competency to be able to care for a specific patient population in order to deliver safe, quality care. This bill is vital to making a significant positive impact in healthcare if passed into law. The key is to have nurses at the bedside using their voice to make a difference. By educating ourselves, it will give us the knowledge and understanding to impact the change needed in our profession. Some background about H.R. 2581. The bill was introduced on May 8, 2019 by Jan Schakowsky. She is the representative for Illinois' 9th Congressional District. This bill is in the first stage of the legislative process. It will be considered by the committee next before it is possibly sent to the House or Senate and ultimately, hopefully, passed to law. A fun fact about this bill was there was an earlier version introduced as H.R. 2392 on May 4th in 2017. It did not pass, thus another version was introduced 2 years later. Summary of this bill's key points. There will be specific nurse-to-patient ratios on all specialty units in the hospital. In developing a staffing plan, the ratios should reflect acuity on the units, admissions, discharges, and transfers. In addition, experience and knowledge of the registered nurse is factored in when discussing ratios. Nurses are responsible for providing safe patient care. A nurse may refuse an assignment if she feels that she's not properly trained to care for that patient on that assignment. And determining obstacles that may prevent any hindrance in providing excellent patient care is one of this bill's key points. There are some pros and cons of HR 2581. Some of the pros are mandating nurse-to-patient ratios will increase nurse job satisfaction and decrease the amount of nurses intending to leave the bedside. Increased staffing ratios will increase patient satisfaction and decrease the adverse events that patients endure when nurses have too many patients to care for at one given time. Cons. Change comes at a price. Hospitals would have to hire more nurses, and that, as we all know, is a timely and tedious process. Hiring more nurses and perhaps giving incentives for nurses to stay at the bedside would ultimately add to the overall costs in the healthcare system. In addition, while maintaining ratios at all times, it may prove to be a challenge when nurses need to travel off the units with their patients or when they take a break. Conclusion. Inadequate nurse-to-patient staffing ratios affect nurses, patients, and their families, as well as hospitals in which the nurses are employed. High nurse-to-patient ratios are directly responsible for nurses' job-related burnout and job dissatisfaction. Hospitals should invest in mandated nurse-to-patient ratios, which would decrease the number of nurses with intent to leave the bedside, improve patient outcomes, and decrease the number of adverse events in hospitalized patients. Evidence shows a direct correlation between poor staffing ratios and poor patient outcomes. I believe it is of vital importance for hospitals to invest in more nurses at the bedside. Nurses need to use their voice and become involved in different ways to make positive changes. Mandating nurse-to-patient ratios will help to maintain a stable workforce while keeping our patients safe from harm.